Well, my name is Don Broder. I'm a retired psychiatrist, and I was a young medical student when the Medicare, the forerunner to what we know now as Medicare, was introduced in Congress in the late 1950s during the Eisenhower administration by a congressman from Rhode Island named Amy Forand, who could see, as so many other people, that seniors in our country were not getting a fair shake, and when they retired from work, unless they had private means, couldn't afford to pay for private insurance, and they had no health care, no access to health care unless they paid for it out of pocket. And in the early 1960s, late 50s, when I was a student, a colleague and my wife, who was also a medical student, decided we wanted to have an opportunity to talk about this and introduce this concept of a bill that would provide government-assisted insurance for seniors to obtain medical care. And we called a number of doctors in the city. I studied in Chicago, big city with 4 or 5 medical schools at the time, and we arranged for doctors to come and talk to the students at my school, the University of Chicago. And it was very difficult to get people to come and talk, number one. And when we finally succeeded in doing it, it wasn't difficult to get people to speak against, but it was very difficult to get a doctor to speak in favor. And at the panel, the doctor, who had come from one of the other schools, began his remarks by saying, "I don't know why they asked me to speak in favor of this bill." But that's a very personal anecdote to illustrate the fierce opposition of all sorts of interests, including the medical community. And the medical community screamed the same things that are being screamed now about reforms in our health care system. I happen to believe that single payer is the best option that we have available to us, and one of the canards that's thrown at it is this is socialized medicine and this will be government-controlled medicine. Well, the government hasn't controlled the care that seniors receive under the Medicare bill, and I doubt very much that that would be the case under single payer. It won't happen. It's a lie.
Thank you.
What else can I tell you?
Well, after the Medicare legislation was passed, how long did it take all of those people that were opposed to it to jump on board?
Not very long. And it turns out that most doctors participate. Some now don't, but most do. And they were very happy in those years to get additional patients who could pay them their fees. Once upon a time, of course, doctors provided free care sometimes for patients who simply couldn't pay, and that was true for seniors. Now seniors had big bucks. They had this insurance plan paid for, quote, by the government, and it satisfied their needs, and they could do what they thought they needed to do for the health and welfare of their patients.
Thank you. Thank you.
So what do you think that needs to be done here to get single-payer health care, either in California or across the country?
I think we need to educate people. I think we have to help people understand what single payer is. We have to help people understand what's been proposed in Congress and why the proposals that are currently being discussed will not succeed in actually reforming our system, will not succeed in providing health care to all of our people, and will not succeed in controlling the increase in medical costs, which are going to drive us broke before too long.